Hello everybody, my name is João Rosado, and me and my fellow colleagues, while working at the emergency department, ED, realized that the number of readmissions to the emergency department was a reality that couldn't be ignored. So, we ended up looking for solutions as the healthcare is becoming more expensive in Portugal, consequence of the overcrowding in the ED, which remains a current problem with a difficult solution to achieve. In our study, we understood that the aging demographic and that statistically the elderly were the principal users of the ED, consequence of the multiple variables of the reality of our society. So, we ended up doing a literature reviews to understand how we could prevent this readmission from happening. And from a total of 98 articles, only 7 would fulfill our eligible criteria, in which we could read that it's important to determine the risk factors for readmission to the ED, so we can signal people with more probability to be readmitted after discharge and tell them which nursing interventions will guarantee the continuity of care after discharge in order to avoid those readmissions. So, to first identify the risk factors, the literature recommends and also highlights the importance of carrying out a holistic assessment of a person, investigating the personal history, polymedication, the current life situation, age, level of dependency, risk of failing, and cognitive function, suggesting the use of different scales. Regarding preventable nursing interventions, it contemplated that follow-up phone calls and the existence of an expert nurse in transition of care who exercise functions exclusively in the person's evaluation, discharge planning, and referral to the community resources had the most significant impact in terms of the decrease in readmissions to the emergency, which enlightened us that one of the problems that must be solved is making the correct transition of care from the hospital to the community after discharge, so that people keep getting taken care of and helped, so that they don't have to look for it in the ED. And this way, the readmission to the emergency department will decrease, like the literature has shown us, and the quality of life of these people will improve in their daily life while being protected of the risk of going to the emergency department that we all know of.